Do you wake up multiple times each night to use the bathroom? If you're over 30, you might think it's just part of aging. But what if I told you that those nighttime trips to the restroom could be impacting your sexual health, specifically your erections? In today's video, we're diving deep into a common yet often overlooked issue that affects men's overall health, nocturia, and how it's secretly linked to erectile dysfunction. Stick around to find out why this happens and, more importantly, what you can do about it. Nocturia refers to the condition in which a person wakes up during the night to urinate. While it is often considered a common occurrence among older adults, especially men over the age of 60, it is crucial not to overlook this condition as a simple part of aging. Waking up more than once or twice during the night to use the bathroom can indicate that something is amiss within the body. It's important to understand the potential causes and how nocturia could affect your overall health. For many, the most obvious cause of nocturia is a bladder that fills too quickly or doesn't empty completely. When this happens, the sensation of needing to urinate comes on even when the bladder hasn't truly reached full capacity. This can result in waking up multiple times throughout the night to relieve the bladder. Additionally, certain drinks and foods, especially those consumed in the evening, can aggravate the situation. Beverages like coffee, alcohol, and even tea can all contribute to increased urination. These fluids, combined with high water content foods, such as fruits and vegetables, further exacerbate the need to urinate at night. Another possible cause is the way the body handles fluid intake, especially as we age. In older adults, the production of a hormone called antidiuretic hormone, ADH, decreases. ADH helps the kidneys regulate urine production, especially during the night when the body is at rest. As the production of this hormone diminishes, the kidneys produce more urine at night, resulting in the need to wake up and urinate. This is often a key factor that many individuals don't realize until it becomes a persistent issue. One of the more overlooked causes of nocturia is the relationship between heart health and urinary function. The heart plays a vital role in regulating the body's fluid balance. When the heart isn't functioning properly and struggles to pump blood efficiently, the kidneys may receive insufficient blood flow, leading to a decrease in urine production during the day. This means that fluid doesn't get processed as it should during waking hours, leading to fluid retention, often seen as swelling in the legs or ankles. At night, when you lie down, the excess fluid that was previously held in the lower body starts to be reabsorbed and processed by the kidneys. This leads to an increase in urine production, which forces you to wake up and use the bathroom. This situation can be especially problematic for people with heart conditions like heart failure or poor circulation. If you notice symptoms like swollen ankles, fatigue, or shortness of breath, these could be signs that your heart isn't pumping blood as effectively as it should, contributing to nocturia. If you're experiencing nocturia and also showing signs of cardiovascular issues, it's essential to consult a healthcare provider. Early detection of heart problems, especially in combination with urinary symptoms, can lead to better treatment outcomes and help prevent further complications. Taking care of your heart and managing your fluid intake is crucial to reducing the frequency of nighttime bathroom trips and improving your overall quality of life. In conclusion, while nocturia is common among older adults, it is not something you should accept as an inevitable part of aging. Understanding its potential causes, whether related to your bladder, fluid intake, or even your heart health, can help you take proactive steps toward improving your sleep and overall well-being. If nocturia becomes a regular issue, it's important to address it with the help of a medical professional to ensure you're not dealing with an underlying condition. To fully grasp the impact of nocturia on erectile health, it's important to first understand the role that sleep plays in sexual function. During sleep, particularly in the rapid eye movement or REM phase, men experience natural nocturnal erections. These erections are vital for maintaining the health of the penis. They help keep the penile tissues oxygenated, ensure healthy blood flow, and stimulate the smooth muscle of the penis to stay functional. These nocturnal erections are a natural part of the sleep cycle and play an essential role in maintaining long-term erectile health. However, when you wake up multiple times during the night to urinate, this disrupts the critical REM phase of sleep. The body is unable to complete the necessary restorative processes that occur during deep sleep, including nocturnal erections. This interruption may be initially subtle, but over time it can lead to a decline in erectile function. As the body fails to produce enough of these nocturnal erections, the health of the penile tissues diminishes, leading to erectile dysfunction. This disruption in the sleep cycle can be especially concerning for men over 40, as their ability to maintain nocturnal erections begins to decline naturally due to age-related changes in hormones, vascular health, and other factors. With frequent awakenings caused by nocturia, the effects on erections are compounded, potentially accelerating the onset of ED. Testosterone, the primary male sex hormone, plays a significant role in sexual health, including libido and erectile function. Testosterone production peaks during the early morning hours, typically during the final phase of the sleep cycle. However, frequent nighttime awakenings interrupt this vital hormone production. When sleep is fragmented, such as in the case of nocturia, the brain gets confused about the natural sleep-wake cycle. This disruption can cause a decrease in the secretion of testosterone, which may lead to a decline in sexual desire and performance. Over time, this decrease in testosterone can exacerbate existing erectile problems and even lead to low libido. Since testosterone levels are closely tied to overall sexual health, poor sleep and its impact on hormonal balance should not be underestimated. Maintaining healthy sleep patterns is essential to ensuring that testosterone production stays on track. One of the most common causes of nocturia, especially in men over 50, is an enlarged prostate, or benign prostatic hyperplasia, BPH. As the prostate enlarges, it presses against the bladder and the urethra, causing difficulty in fully emptying the bladder. This leads to frequent urination, often at night. In addition to the discomfort and inconvenience of nocturia, BPH can further contribute to erectile issues. The pressure on the bladder from an enlarged prostate can reduce blood flow to the penile area, impairing erectile function. The mechanical pressure from the prostate, combined with the psychological stress of dealing with frequent bathroom trips, can contribute to erectile dysfunction. If you're experiencing nocturia and suspect BPH as the underlying cause, it's important to have your prostate health evaluated by a urologist. Early detection and treatment of BPH can help manage both the urinary and sexual health aspects of the condition. While BPH is a leading cause of nocturia, there are several other factors that can contribute to both nocturia and erectile dysfunction. Diabetes. High blood sugar levels in diabetics can lead to frequent urination as well as nerve damage, including damage to the nerves that control erections. The increased urination associated with diabetes can worsen nocturia and further contribute to erectile dysfunction. Sleep apnea, especially common in men over 50 and those who are overweight, leads to fragmented sleep. This disorder causes frequent awakenings during the night, which disrupts the natural REM sleep cycle and interferes with the body's ability to produce the necessary nocturnal erections. Mental health, depression, and anxiety are also known to affect sleep and contribute to nighttime awakenings. The emotional strain caused by mental health issues can lead to an increased frequency of urination at night, worsening nocturia and affecting sexual health. Stress, chronic stress, and high levels of cortisol, the stress hormone, can also negatively impact both sleep and sexual health. Stress may increase the frequency of nocturnal urination and interfere with the production of sex hormones, leading to a decrease in erectile function. If you're struggling with nocturia and erectile dysfunction, there are several steps you can take to improve your situation. Limit fluid intake before bedtime. Reducing your fluid intake in the evening is one of the easiest and most effective ways to combat nocturia. Avoid drinking coffee, alcohol, and caffeinated drinks in the hours leading up to bedtime, as these can irritate the bladder and increase the frequency of urination. Consult a doctor. If nocturia is becoming a regular issue for you, it's crucial to consult a healthcare professional. A urologist can help determine if your nocturia is linked to an underlying condition such as BPH, heart disease, diabetes, or sleep apnea. Treatment options may include medication, lifestyle changes, or surgery, depending on the severity of the condition. Monitor your health. Tracking your fluid intake, urination habits, and any swelling in your legs or ankles can provide important clues about your overall health. Be mindful of any changes in your body and share them with your doctor. Lifestyle changes. Maintaining a healthy weight, eating a balanced diet, and exercising regularly can help improve both your urinary and sexual health. Exercise in particular can help improve blood flow and hormone levels, which are essential for erectile function. Improve sleep quality. Good quality sleep is essential for overall health, including sexual health. Consider using sleep aids such as a comfortable mattress, a sleep routine, or relaxation techniques to improve your sleep quality. Reducing stress through meditation, yoga, or breathing exercises can also help enhance your sleep and sexual function. In ancient Rome, there was a principle of moderation that is still relevant today. Moderation in diet, exercise, alcohol consumption, and even in our emotional responses can help maintain balance in the body. This principle is key to maintaining both urinary and sexual health. By avoiding excess and focusing on balance, you can improve your overall well-being, including your prostate health, erectile function, and sleep quality. If you're waking up multiple times during the night to urinate, it's not something you should ignore. While occasional nighttime urination may be normal, frequent trips to the bathroom are a warning sign that your health needs attention. It's important to address this issue not only to improve your quality of sleep, but also to protect your erections and overall well-being. If you're dealing with nocturia, don't wait for things to get worse. Seek professional help, make some lifestyle changes, and take control of your health today. Remember, you're not alone in this, and there are solutions available that can help you regain control of your body and your sexual health. If you found this video helpful, don't forget to hit that subscribe button, like the video, and share it with friends who might benefit from this information. Your health is important. Let's spread the knowledge and help others live their best lives.